All I'm doing right now is taking you through the steps of the physical. We put those into perspective when we start putting it all together as identifying yourself, identifying your client, washing your hands, explaining the procedure, providing for privacy, because with a physical examination, there's going to be some exposure. Now, also bear in mind that we keep the client covered when we are doing it to preserve modesty and provide privacy. However, for the purposes of demonstrating how to look at things, I will not necessarily, since she is completely clothed, have her covered at all times. That's just for the demonstration's sake, so I can show you simultaneously while I'm doing different things. So while this is a demonstration of a history and physical, remember this is for taking it step by step of the physical part. I am not in tune right now to the beginning and ending steps as they apply to a checkoff scenario. Is my disclaimer clear?
Yes.
Okay. All right. So that being said, I'm going to uncover her where I normally would not do that. Now, this is going to take a good 30 to 45 minutes. For you to do, if I were actually doing it in real time, it wouldn't take 10 to 15 minutes. But I'm going to slow it down and go step by step so that you can see what we're looking for. And then tomorrow, after you've had an opportunity to at least read and start assimilating the information, I will show you what it will look like in a checkoff before you have to do it, because you got another week after this to practice this. This checkoff's not coming till week after next. Next weekend is vital signs and height and weight and TPR. All of those things we hope to get done. All right. That being said, I need someone to, Heather, come up here, please. So that I don't have to stop and look, because I don't want to miss anything. You are going to be the narrator, if you will. And I need to plug in my... So, what is the equipment that I need to do a physical?
Your pen light.
I need a pen light.
Your stethoscope.
I need a stethoscope.
Your blood pressure cuff.
Blood pressure cuff. Yes, but the vital signs are not part of this checkoff. But yes, if you're going into your room, that we do it all at the same time. Pen light. You may or may not carry around a reflex hammer with you. If you do not, you can use the edge of the diaphragm of your scope. It works great. But this is a reflex hammer. Come on in. Come on in. Okay. You need me to break? You need to speak with anybody? Okay. So, this is that wonderful little tuning fork that we talked about when we were talking about different types of hearing.
Mm-hmm.
You don't necessarily need that for physical, but I want to show you what it was. I was playing with it yesterday. I just had it. And a pen light. I will be using the, this is my pen light, and I'll tell you why. Whoever borrowed my pen light last semester did not give it back. So I gotta go buy another one.
Where do you get them?
I usually get them, order them online, or a lot of the pharmacies sell them. Where you find me? Okay, so now we're going to start in the beginning. And remember, what's first, Madam Narrator?
Head and face, level of consciousness.
Okay, we're going to do a head-to-toe assessment, and what I'm going to do is I'm going to start by inspection. Inspecting, I'm looking at her face. I am looking at everything that I can see here is one that she's got 2 eyebrows, she's got eyelashes, she's got 2 eyes, she's got a nose, a mouth, she's got ears. And I'm looking at it, but then I'm going to palpate the head and scalp. And remember, with palpation, it's a light touch going to a deeper touch. And what we usually do is, if you get in the habit of making small little circular motions with your fingers, it helps you palpate any of the underlying structures that may or may not need to be there. So I've explained everything, and I'm looking at her, and I'm looking at her, and then I can start by, and all I'm feeling for as I'm feeling through her head and her scalp is I'm feeling for lumps, bumps, bruises, unevenness in bone structure, like, skull fracture. You can also sometimes feel it. I'm feeling for the bones in her face, her zygomatic arch, making sure that everything is okay. What's next?
Next, the pupils.
Next is pupils. Pupils, when you look at somebody's eyes in this first few minutes, and I've also touched her head, and we'll put all that together and assimilate it. But I can check her pupils, and here's the thing. First I'm going to look at her eyes, and she's got two eyes, and when she's looking at me, they're nice and equal. But when I go to do the pupils, I need to check pupillary response, extraocular eye movement, and accommodation. So the way that I do it, and as long as you hit these areas, if you do accommodation first, it's not going to bump you out. You just have to hit these important marks, okay? I mean, of course, if you get down to the feet, I would prefer that you not go back up and do the pupils. You need to do them while you're going down. So here's what you have to know about doing the pupils. The best way to do the pupils is to dim the lights, okay? And then you're going to take your pen light, and you're going to come, and you're going to have them try to look straight ahead, look at me. You're going to come over, and you're going to, and what you're looking at is the size of the pupil, and the size of the pupil, how it constricts down when the light hits it. Then you come around, don't do this, don't go this way. Come around and say, look straight ahead for me. Okay. What I'm looking for is that her pupils are equal, they're round, they both react to light the same way. And you're like, well, I don't understand, Miss Rose, what does that mean? Her pupils, the light is dimmed, and I'm just looking at them, her pupils are about 3 millimeters round. I just know that because I get used to it. There's actually scales you can look at if you don't know. When I shine the light in it, the normal response for the pupil to light is to constrict. So when I shine the light into each eye, they both constricted down to 2. So that is equal to, pupils are equal, round and reactive to light. Okay, that's the PRL. So they both reacted to light equally. Then if they didn't, say one pupil was very dilated and the other and wouldn't react and the other did fine, that is an abnormal finding. I don't expect you to know what the abnormal finding is. I just want you to know it's abnormal, and we're going to have to correlate that with the rest of the case. Is it a head injury? Did she fall and bump her head? Does she have a migraine headache? What's going on? Or one time, I've had somebody come in that had a fixed and dilated pupil. He walked in, he was fine. The other was fine. He said, I just don't understand it. He said, I feel fine. We got to talking to him, and he had been working with some chemicals, and he rubbed his eye, and we called poison control. That chemical had
A dilating agent?
It had a atropine in it, which will cause people to dilate. He was perfectly fine. His pupil was reacting to what was on his hand, that chemical, when he rubbed his eye, and it made the pupil dilate. That happens in cardiac arrest. There is a drug that we give in cardiac arrest that makes the pupils go poof. It's a side effect of that drug, but you wouldn't know that. You don't have to know that. You just have to know that they're supposed to be equal, round, and reactive to light on both sides equally. If it's not, that's an abnormal finding. All right, so I've done the pupils, equal, round, and reactive to light. Now I've got to do extraocular eye movement, and I've got to do accommodation. All right. Most people will take their pen light and do it right then. They'll do this, and then they'll say, okay, follow this. You're not shining the light of your pen light in them doing this. You're just giving them a point of focus. So, would you follow this for me with your eyes only? All right. And she can be laying like this. You can set her up, whatever, just so you can get into her field of vision. Okay, you're going to go up, 1, 2, 3, cross over, and 1, 2, 3, and cross again. Your book does not teach it this way. But if you do it this way, you get every single, nothing, I'm just gonna, it's a Facebook post probably, I need to. You will get all the inferior, the superior, the lateral, and the medial, and the oblique eye muscles tested if you go. See, watch her eyes. See how it's following it? I'm going to set you up so they can see your eyes. Okay? Can y'all see her better now? You go up, down, up, down. Watch. See, she's going this way. See her eyes? Now watch. It comes up.
It's like a bow tie.
Yeah, I get you. But if you do the crossover for the accommodation, you're going to hit all the ocular muscles, not just the superior, lateral, medial, and inferior. That you'll get that circle one too. That's not only checking eye muscles, it's also checking neuro, because there are like 3 different cranial nerves that all help control the movement of the eye and the pupil. So if I do this and she doesn't follow it, or one eye stays this way and one eye follows it, that is an abnormal finding. I'm not asking you to tell me what it is. I just want you to know it's normal, okay? So we've done this, and now we're going to check for accommodation. This is extraocular eye movement. People think this is checking for accommodation. This is accommodation. All right, I want you to focus on this pen, okay? And what I'm looking at is I'm looking at what her eyes are doing, but I'm also looking at her pupils. There's no light here, just pupils. I'm going to go in with it, just follow it all the way in, all the way in. That's accommodation. What you're looking for is that both eyes converge together, and there's usually a slight pupillary response going from right here to right here. The pupil usually constricts, okay? That is the pupils. That's the head, the pupils. What's next?
The smile.
Okay, so you're just going to say, can you smile for me? Show me your teeth. There. You can even go a step further if you want to. It's not on here. Can you stick your tongue out for me? Okay. What was I checking for?
Discoloration.
Well, I'm checking for symmetry, muscle control. If she's had a stroke or something neuromuscular, she might do this, or she might not be able to do it all. She may not be able to stick out her tongue. In addition to that, when I'm looking at this, you'll learn to start coordinating your efforts. I can see right away the color of it too, which is coming up. So I've checked for facial symmetry. I had her smile. What's next?
And her skin.
Her skin is warm because I touched her. Her skin is warm. She's dry. I also check this anytime I'm going down the body touching her. I can also assess this. She's warm. She's dry. Her color is normal, but it could be pale. It could be she could be pale. She could be diaphoretic. She could be cool. She could be clammy. She could be hot and dry. She could be very red, but she's nice and color's normal. Her lips are pink. She's warm. She's dry. Level of consciousness. I'm gonna say, can you tell me your name?
Joanne.
Do you know what day it is?
Yes.
What day is it?
February 4th.
5th.
5th?
I'm like, what year is it?
2014.
Do you know where you're at?
At school.
Okay. So, awake, alert, oriented, person, place, time, situation. I used to ask people, well, who's the president? And then they can't say, well, I'm not real sure what the day it is. I said, well, do you know who the president is? Because little old people sometimes lose track of their days. Middle-aged people lose track of their days. All right, what's next?
And you just checked her speech because you asked her questions. Her mouth.
Yep. So at this point, I'm going to give you some tongue blades to practice with. You don't have to stick it in each other's mouth. Yes?
What about